About the health of our children. Respiratory viruses like RSV are still making kids sick and keeping pediatric hospitals busy.
But one medical center here has a unique tool to combat the virus, and it's the only hospital using this. WRTV's Nikki DeMentri is here in studio with more on the hope that this tool is now providing. Nikki.
It's key right now as we continue this fight against RSV. Now that hospital is Peyton Children's Hospital. It's up on the northwest side, as we all know. I talked to the Indiana Hospital Association today. They tell me that 70% of pediatric ICU beds are filled across the state. They also add some facilities have only about 10% of PICU beds open. Take a look inside Peyton Children's Hospital's pediatric intensive care unit.
We're getting calls from not only all over the state, but also neighboring states where they're just desperate to look for a place to send the baby.
As of Monday afternoon, the PICU is at capacity with half of the patients fighting RSV. This all comes as the surge in the respiratory virus continues.
I did not realize how sick she was until looking back.
Last month, the Lyle family spent 6 days on the PICU floor. Then 7-month-old Hannah was admitted with RSV.
We've had surges of RSV in the past, but not to where it's sustained for this long and where I've had it to need extra amount of staff, extra amount of supplies just to help cover these kids who are really sick.
Roger Undos is the manager of respiratory care at the Children's Hospital.
If we can do anything we can to try and relieve work of breathing, relieve that distress that we see these kids come in, we're going to try it. And so the chest caress is just one of those tools in our arsenal.
That tool is also known as the turtle shell.
I'm going to start it. So as I start it, I'm just going to kind of hold the shell onto our patient just to make sure I get a great seal.
It was a part of Hannah's treatment while in the PICU.
My biggest fear was her being put on a ventilator because that was definitely talked about.
The main goal of the treatment is to do just that, prevent a child from going on a ventilator. Peyton Children's is the only hospital in the state with this technology. And good news to report. After a week's stay at Peyton Children's Hospital, Hannah, well, she's back home and thriving, I'm told, with her twin brother Nolan. She'll be 8 months later this week. And just a reminder for parents and guardians out there, the Indiana Health Association is asking families to avoid the ER for any mild symptoms or if you need any routine testing at this time, just to make sure those sick kids can get in when they need to.
And we're so glad to hear that Hannah is improving. You know, Nikki also checked in with Riley Hospital for Children today on the status of RSV. The health system notes it's seeing a 10% increase in patient volume over the last week. ER capacity downtown and in the PICU at IU Health North have also been expanded.